Hello everyone, once again welcome back to all. So in today's video I am going to explain you the fetal circulation. So as the word comes fetal, so what do we mean by the fetus? So the fetus here stands the baby inside the mother's stomach, a mother's tummy, that is from the gestation period from the 9 weeks till the birth of the baby, that is known as fetus. So fetus from the 9 weeks till birth is known as the fetus. So in this, how the blood supply will be there in the fetal, so we are going to learn the fetal circulation. So from the fetal circulation, as we all know, we have one umbilical cord. So suppose this is a umbilical cord in which we have 2 arteries and 1 vein. So how we can remember that we have 2 arteries and 1 vein? So please remember it like this. So this one is our umbilical cord. As we cut the umbilical cord, we can see this, in which we saw there were 2 arteries and 1 vein, as the mouth of this look like V shape, and that is, as we rotate this, it is a vein. So we all have one mouth, means one V is there. So in the fetal circulation, in the umbilical cord also there is one vein. So one vein and 2 arteries will be there in the umbilical cord. Now here we have, this one is the placenta. So this one is a placenta. From the placenta, the oxygenated blood will go to reach to the baby by the umbilical vein. So umbilical vein. So this one is a umbilical vein. And in the umbilical cord we have one umbilical vein. One is the vein and 2 were the arteries. So here one more point, as like in the pulmonary vein, aorta and in the pulmonary artery and in the pulmonary vein. So in pulmonary vein there is a oxygenated blood supply will be there. So similarly in the umbilical cord also, in the vein there is oxygenated blood. So in umbilical vein contains the oxygenated blood, while the umbilical arteries have deoxygenated blood. So here I almost covered 2 questions. First one, how many arteries and veins in the fetal circulation? So there were 2 arteries and 1 vein. So arteries look like eyes, and V is a mouth. So we all have one mouth, and it's here by this image we can remember V is vein, which supply the oxygenated blood to the fetus. So here this one is the placenta. So this one is a placenta. From the placenta through the umbilical cord, the blood reaches to the fetus. So the umbilical vein contains the oxygenated blood. So as it reaches to the fetus, so here this one is our baby. This one is our baby's tummy and baby's head is there. Please ignore, it's a very funny diagram. So as the umbilical vein reaches to the fetus, so here which is the first organ it passes, when the oxygenated blood enters the baby, the first organ it touches is, so which is the first organ? So the first organ it touches is the liver. Please remember, in the liver, the umbilical vein first touches the liver. So in the liver, how the umbilical vein reaches? So as the umbilical vein reaches there, so just I have to draw this little above. So as the umbilical vein touches the liver, in the liver we have one venosis, and that venosis is ductus venosus. That one is the ductus venosus. So in the ductus venosus, so how the umbilical vein connects to the ductus venosus? The umbilical vein connects to the ductus venosus by a portal vein. So please remember, by the portal vein it enters to the ductus venosus. The umbilical vein enters to the ductus venosus like this, and the blood passes, it bypassed the liver through the ductus venosus, and the ductus venosus is going to continue as the inferior vena cava, going to continue as inferior vena cava. This one is the portal vein, and this red one is the ductus venosus. Please remember. So as the umbilical vein passes through the ductus venosus is present in between the inferior vena cava and the portal vein. Please remember this question, that ductus venosus is present between inferior vena cava and the portal vein. So umbilical vein continue as the portal vein, and through the portal vein it bypass the liver via the ductus venosus and reach to the inferior vena cava. So now next, after the inferior vena cava, as we all know, we have heart, and in heart we have right atrium, right ventricle. So this one is the right atrium, left ventricle, and right ventricle. From the right ventricle we have the pulmonary artery. From the left ventricle we have the aorta, and the pulmonary artery gives blood to the lungs. Lungs are not here present, but I am drawing it like here, so you can remember it easily. So this one is the lungs. So from the lungs we have the pulmonary veins. Which supply the oxygenated from the lungs. The blood gets oxygenated and it reaches to the left atrium by the pulmonary vein. But in the fetus, their lungs are not functional. So in the fetus, how the lungs are present? So in the fetus, the lungs are in the collapse form. Please remember that lungs are collapsed in the fetus. So in the fetus, the lungs are collapsed. They are not working. They are not functional. So lungs are not functional means the blood is not going to reach to the lungs. So now how it works? So as the inferior vena cava, from the inferior vena cava, the blood enters to the right atrium. So almost in the right atrium, the 1/3 of the blood reach to the left atrium. So please remember that 1/3 from the right atrium, the 1/3 volume of a blood is going to the left atrium directly. So how it will going directly to the left atrium? So please remember, here we have one ovale, that is the foramen ovale. Please remember, by the foramen ovale the blood is going to the left atrium directly. And how much volume? It is the 1/3. So 1/3 volume of the blood is going directly from the right atrium to the left atrium, and remaining 2/3 is going to reach to the right ventricle. So this one is the till the right ventricle, and in the right atrium the blood also come by the superior vena cava. From the superior vena cava also the blood is going to the right atrium. So till this we have no problem. I hope almost everything is going to be cleared in your mind, that umbilical vein, first it touches the liver. Liver is the first organ it touches, and it bypasses the liver by the ductus venosus. And ductus venosus is present in between the inferior vena cava and the portal vein. So now after the blood is from the inferior vena cava reaches to the right atrium, and also the blood is coming from the superior vena cava, which is also going to reach to the right atrium. Now from the right atrium 1/3 volume of the blood is going to the left atrium, while the 2/3 volume of the blood is going to the right ventricle. Till this I hope everything is going to clear in your mind. Now let's move ahead. So from as the 2/3 volume of the blood is going to the right ventricle, so all we have one thing, now we are thinking that from the right ventricle blood is going to the pulmonary artery, then lungs, then pulmonary vein. But please take a look here, that here the lungs are not functional. In adults this one is the same process. In adults we have like functioning lungs is there, so that's why blood reaches to the lungs. There it get oxygenated and reach to the pulmonary vein. But here nothing is like this. So here we have one ductus arteriosus. We have ductus arteriosus. From the ductus arteriosus, the blood which reaches to the right ventricle, that is the 2/3 that reaches to the right ventricle, is going to shunt from here to the aorta. That is by the ductus arteriosus. Please remember, here is the ductus arteriosus. So in whole this mechanism, there are three places where we have shunt, like ductus venosus, which bypass the liver. Then we have foramen ovale. From the right atrium, the blood reaches to the left atrium, and the third one, that is the ductus arteriosus, from which the right ventricular blood, which reaches to the pulmonary artery, get shunted towards the aorta. And that aorta is not the aorta, that is the descending aorta. Please remember, that one is the descending aorta. So here one more question is going to ask, like ductus arteriosus is present between the, so ductus arteriosus is present between pulmonary artery and the descending aorta. And what is the blood flow of the ductus arteriosus in fetal circulation? So please remember here, all the blood from the right ventricle is going to the left side, means in the descending aorta. So the direction of blood flow is from the right to the left side, from the right side to the left side, because lungs are not functional. Lungs are in collapse. Lungs are collapsed in the fetus. So that's why the direction of blood flow through the ductus arteriosus is right to the left side in the fetus circulation. So after aorta, the all blood going to the systemic circulation, like in the systemic parts. After that, all the deoxygenated blood from the collected from the systemic circulation, the all deoxygenated blood is going to return to the placenta to get oxygenated, because in the fetus there is no place where the blood get oxygenated, because in adult or in human circulation, in our adult circulation, the blood is oxygenated in the lungs, and there the deoxygenated blood gets oxygenated. But in the fetus, there is no place where the deoxygenated blood get oxygenated. So the place is in the placenta, where the deoxygenated blood is going to be oxygenated blood. So the whole blood is going to return to the placenta. So how it will return? It will return by the umbilical artery. And we all know we have two umbilical arteries. So we all have two umbilical arteries, and here the blood is going to convert into the oxygenated form. So this one is our umbilical cord. So here this one is our umbilical cord. So in umbilical cord, how many umbilical artery and umbilical vein is present? Please remember this diagram. If you are going to remember this diagram, then every question you can answer very easily. So now my first question I am going to ask you after all this explanation. Please tell me that in the umbilical cord, how many arteries and veins are there? So there are two arteries and one vein is there. Now umbilical vein is continue as the portal vein, and portal vein connects ductus venosus and it bypass liver and connects later to the inferior vena cava. Now we have questions, the remanence. So before remanence, first we will cover the remanence. So remanence. So in the remanence, I am going to ask you some questions, like the first one we have the, so first one is the ductus arteriosus. By mistakenly I wrote the venosus, but here it is ductus arteriosus. So the remnant of ductus arteriosus, ligamentum arteriosum. Please remember, that is ligamentum arteriosum. Now the second one, that one is the umbilical artery, our umbilical artery. So umbilical artery remnant is a medial. Please here remember, it is medial, as in the umbilical there is AL is there, AL is there. So here it is medial umbilical ligament. Medial umbilical ligament. After umbilical artery, we have the umbilical vein. So umbilical vein. So in the umbilical vein, the remnant is going to be ligamentum teres hepatis. Ligamentum teres hepatis. After the umbilical vein, we have the ductus venosus. So ductus venosus. So ductus venosus is going to convert into the ligamentum venosum. ligamentum venosum. After that we have, that is foramen ovale. So in the foramen ovale, that ligament is going to be fossa ovalis. Fossa ovalis. So all these were the remnants. The ductus arteriosus is the ligamentum arteriosum, umbilical artery, medial umbilical ligament, umbilical vein, ligamentum teres hepatis, ductus venosus, ligamentum venosus, and foramen ovale, that is the fossa ovalis. Sorry, here it is ductus arteriosus. So ligamentum arteriosus. Now we have the few questions about the closure. So in the closure we have time. So first of all, as we cut the, here in the diagram, as you can see, as we cut the umbilical cord, as we cut, so there is the functional closure of the ductus venosus. So ductus venosus functional closure is just after removal of the umbilical cord clamp or removal of the placenta, there is ductus venosus closure, and the anatomical closure is after the 7 days. So ductus venosus is going to, as we remove the placenta or the umbilical cord, so after removal of placenta or umbilical cord, there is the functional closure of the ductus venosus, and anatomical closure is after 7 days. After the ductus venosus we have the ductus arteriosus. So in the ductus arteriosus the closure will be 10 to 15 hours. This is the functional closure, and 10 to 21 days there is the anatomical closure. Now the next one is the foramen ovale, that is the foramen ovale. So foramen ovale closure is during breastfeeding, and the anatomical closure is in months or in year. Now that one is, other one is the umbilical artery. So the umbilical artery is going to close spontaneously, functional closure will be there, while after 2 to 3 months there is the anatomical closures. So this is the functional and anatomical closure. Now I have few questions like related to this. So I am going to ask you, and you have to answer in the comment section. If you read my whole, if you listen my whole lecture, so please answer in the comment box. What is the remnant of the ductus venosus? My second question is, how much blood is going from right atrium to the left atrium? My next question is, how much blood is going to enter to the right ventricle? And my another question is it true or false that lungs are never functioning in the fetal circulation? If it is true, just put it true. If it is wrong, then just put it false. So these all are my questions. Now my last question is, ductus arteriosus is present between, so you have to answer in the comment section. Now my next question is, what is the flow of ductus arteriosus? Like, what is the direction of blood flow through the ductus arteriosus? It is whether left to right or right to left shunt. So please write all these questions. And if one more mnemonic I have to tell you, that this ductus arteriosus, we have to sometimes we have to maintain this ductus arteriosus. So first of all, please here remember that we have PGE1 and we have PGE2. So E2, as 2 means 2, so it comes through the placenta. So placenta is maintaining this patent ductus, this ductus arteriosus to open. So plus keep. So PGE1, prostaglandin E1, E2, they keep the ductus arteriosus to be open. So PGE2 is endogenous because it is released by the placenta. So that's why during fetal circulation this ductus arteriosus is always open. But PGE1 is exogenous. We have to take it from outside. That is, like example is L-prostadil. So these all maintain the patent ductus arteriosus to be open. Now so these keep open. L-prostadil. Now we have to close the ductus arteriosus. So which is going to help to close the ductus arteriosus? First one is the oxygen, second one is like ibuprofen. So these are going to close the ductus arteriosus. And another, like we have bradykinin also, it is also going to help to close the ductus arteriosus. So and ibuprofen, and we also have endomethacin, which is also going to close the ductus arteriosus. So we can give all this, but the most important is ibuprofen. We prefer ibuprofen for closing of the ductus arteriosus. So we can remember it like keep open. So keep open by prostaglandin. So prostaglandin is keep opens. In the keep we have EE is there, it means PGE. So this E stands for keep. So keep open ductus arteriosus is PGE1, PGE2, and like oxygen, ibuprofen, bradykinin, endomethacin, these all going to help to close the ductus arteriosus. So that's all for the fetal circulation. I hope this topic is very much clear to you. Thank you. Bye bye guys.